And we go to our slides about procedures. And we start with the, so start now, the slideshow. Well, so according to the article that we've just read, let us choose the words which are given here in the sentences. And Arun Chalam, will you read the first sentence here, please?
Sure, ma'am. According to the article, which alternatives in italics below makes these sentences true? During the year, trainees are examined by assessors, various assessors. ma'am.
Various assessors, not the same. Yes,
Same,
you're
yes,
right.
ma'am.
Okay, Madhumita, the second one, please.
Yes, ma'am. The timing, the procedure, and the observer are chosen solely by the trainee.
The trainee, yes, solely by the trainee. Okay, Divya, the next sentence is for you.
Um, DOPS was created by the OCP.
By the college, yes. So this is the function of this college to improve the practice of medicine by examination. So, and this college just set international standards in medicine. The next is for Priya. Sentence number 4,
Yes,
please.
As part of the foundation program, it is suggested that weakness of each trainee is a dope should be improved. Suggested.
Mhm. Here we need to choose expected. So they expect this. It is expected that their weaknesses should be improved. Okay, so the next is for Rajkumar.
Preparation for a dog's encounter on the part of trainee needs to be very evident.
To be very evident. Okay, so, and the next is for Badris. Is Badris with us?
Yes, ma'am. It's May, ma'am.
Number 60.
During a DOPS, the trainee may seek help from anyone else.
So what did you choose? May or must not?
May, ma'am.
May. May seek help. Okay, you're right. And the next is for Prerna. Prerna.
Yes, ma'am. Communication skills are considered during the examination.
During the examination, yes, perfect. You're right. And let us focus on the questions which are given here. The questions about the information which was given in the article, and try to answer them. Nishat, please, the first one.
Yes. What is the purpose of DOPS, ma'am? Ma'am, the purpose of DOPS, like to contact, like using the words like to express our feelings and to communicate with the patients, like with having a short words or interacting with them.
So this kind of the purpose of this kind of organization is to deal with doctors, not patients.
Yes, practical skills.
Yes, so to provide.
Like as they are developed by a particular college, they have this different skills, or like special skills or medical skills which should be like applied.
Yes, to provide feedback on skills.
Yes, provide feedback. Which are essential for clinical care.
Yes, for clinical care. Yes. Okay, so if we look at the next question, That was, who was that? Prerna, yes? Nishat, sorry. Now, Prakriti,
Yes, ma'am.
Prakriti, please. The second question is for you. Prakriti?
Ma'am, how many time, ma'am, how many time a year will trainees be observed?
Do you remember? Who remembers?
Ma'am, can I?
4 to 6
Ma'am,
weeks.
can I?
4 to 6 weeks.
So we can
Ma'am,
just
4 to 6 observed encounters, ma'am. Or
Observed
procedures in a year,
encounters.
4
ma'am.
to 6.
4 to 6.
So
4
yes,
to 6.
Fifth line, ma'am.
yes.
4 to 6 observed encounters.
Observe encounter.
Observe and encounter
Observed
procedure
sessions.
during.
Okay.
Yes.
Well, the next question is for Samhita.
Yes, ma'am. The question is how long does each procedure last? Ma'am, each procedure lasts for 20 minutes, 15 for the assessment and 5 for the feedback.
Good. Yes, we do remember this.
Yes.
So the next
Yes, ma'am.
is for Rafael.
Yes, ma'am. What kind of specialists are the assessors? Ma'am, the assessors are the experienced specialists, ma'am, then appropriate nursing staff, ma'am, and consultants, ma'am, and secondary caretakers, ma'am.
Exactly. Good. And then let's listen to Aymen. Aymen?
Yes, ma'am. Says what competence are trainees assessed? So, what competence? Should be the answer.
What competence?
Ma'am, I think, ma'am, this is they are assessed for the competence in practical procedures that they directly undertake under, ma'am, this DOPS.
Practical procedures, you're right.
Yes, ma'am.
Well, the next one is for Arun Chalam.
Which organization created the DOPS? The RCP, Royal China.
So this is the college. Okay, good. So I think this information is useful just for people who just wants to work as a doctor. And there is one more question here. What criteria are mentioned in the last paragraph? So, I mean, if we speak about the assessment, we need to know the criteria. Well, and so what are they? Let's listen to Madhumita.
Is to perform a particular procedure, and the trainee needs to demonstrate an understanding of relevant anatomy and the technique of procedure. Those lines.
Understanding the anatomy, yes. What else?
Then there needs to be clear demonstration of appropriate preparation before the procedure, and also he has to have a proper knowledge of analgesia or safe sedation.
Okay, so let us just focus on this criteria one more time. And so also, what kind of skills should be demonstrated?
Communication skills.
Yes, communication.
Management and communication skills.
If, for example,
As well as
yes, if you don't know how to do something, you should just ask for help. And other skills, as it says, this paragraph says.
post-procedure management.
Yes.
Good communication skill, as well as we should consider the feelings of the patient at the same time.
Okay. Well, so you shouldn't forget that you are part of a team, and you can rely on the other members of the team if you don't know something. Well, So these are the criteria. Trainees' ability to perform a procedure, to demonstrate an understanding of relevant anatomy and technique of the procedure, trainees' knowledge of the appropriate analgesia or safe sedation and aseptic technique, trainees' ability to demonstrate post-procedure management, and trainees' good communication skills. Well, and can we move to the next slide? Yes.
Listening to.
Just a minute. Now, trainees in this program need to demonstrate practical skills, like here we are going to focus on how to give instructions when just a doctor works with the patient. So now we are going to look at the pictures and listen to the information, and you should match each instruction which you'll hear with the picture. So the picture in the upper row and in the lower row. So let us start listening, and you'll tell me if you hear or you don't hear. Okay.
Listening to. 1.
Yes, ma'am, it is audible.
Okay, so now.
Listening to. 1. Can you just bend your head slightly to the left? Okay.
So which picture is it?
Ma'am, in the second
Last
row,
one.
last one.
The
Last picture.
Second row, last one.
Exactly.
2.
I'd like you to raise your arm above your head for me.
The first
Fourth-
last.
First row, last
Fourth
picture.
image.
Fourth one, ma'am.
First fourth.
Yes, yes, this is. Next.
3.
Now roll your sleeve above your elbow. Yes, that's fine.
Ma'am,
Second
fifth
row,
one,
first
ma'am.
picture.
Yes, ma'am.
Second line
Second
of
one.
first
Fifth
row.
picture.
Yes, ma'am, that one.
This one.
Yes, ma'am.
4. Would you just pop up on the couch for me? That's it.
First.
The first.
First.
The very first picture.
Yes, yes.
Up on the couch for me.
5.
Could you lean forward a little bit for me? Good, that's it.
First
picture.
row,
Third
second
row.
picture, ma'am.
Second image.
Third,
Second image.
Third image.
Second, ma'am, from
Yes.
left.
Third.
Third, ma'am.
Right.
ma'am.
Yes, okay.
Third image.
6.
If you could just move towards the edge of the couch. Yes, that's it.
Second row, second
Second
picture.
image, ma'am.
second, ma'am.
Middle one.
Sixth
Second, ma'am.
picture.
This, the second
picture.
picture.
Yes, ma'am. Second line.
Okay.
7.
Now I want you to just turn over onto your tummy.
Second image, ma'am.
Second image,
Second
first row,
image.
ma'am.
First image.
Throw second image.
Okay.
First row, second.
Yes, exactly. This.
First and second image.
So what is important to focus on in these instructions is the way the instructions are given. So let us try to listen for the second time, and you just try to make notes about each instruction and just write the instructions which were used by the doctor. Okay. So, and then we'll discuss it. So now I'm starting the recording, and you start making your notes.
Listening to. 1. Can you just bend your head slightly to the left? Okay. 2.
I'd like you to raise your arm above your head for me.
3,
Now roll your sleeve above your elbow. Yes, that's fine.
4. Would you just pop up on the couch for me? That's it. 5,
Could you lean forward a little bit for me? Good, that's it.
6,
If you could just move towards the edge of the couch. Yes, that's it.
7,
Now I want you to just turn over onto your tummy.
So, have you written all the phrases? Or do you need to listen for the second time? Okay, let's listen for the second time just to make sure that everyone just has written everything. Oh.
listening to. 1. Can you just bend your head slightly to the left? Okay. 2,
I'd like you to raise your arm above your head for me.
3,
Now roll your sleeve above your elbow. Yes, that's fine.
4. Would you just pop up on the couch for me? That's it. 5,
Could you lean forward a little bit for me? Good, that's it.
6,
If you could just move towards the edge of the couch. Yes, that's it.
7,
Now I want you to just turn over onto your tummy.
Well, now let us comment on each picture. So the first was this picture, the last picture in the second row. Let us listen to, who did we stop with? Okay, let's start with Arun Chalan. So,
Yes, ma'am.
what does?
Can you bend your head slightly to the left for me? That sentence matches with the last picture.
Yes, yes. Can you just bend your head slightly to the left for me? Okay. So then, Madhumita, the picture.
Can you raise your hand? Can you raise your hand above your head, ma'am? It's slightly. That matches the fourth image.
Yes. And does everyone agree that it was can you, or was it another phrase?
Ma'am, it was I'd like you to raise your arm
Yes,
above
yes,
your
right.
head
ma'am.
for me.
Okay. So picture which just was 3. This is the first picture in the second row. Let us listen to Divya. Are you here? No, Divya. Priya, please. Priya.
Yes, ma'am. Now roll your sleeves above your elbow.
That's it. Okay. The next is picture 4. Picture 4, this is the first one. And let us listen to Rajkumar. Rajkumar? Hello? No, Rajkumar. So minus. Badris, please. The first picture. Badris? No, Badris. Prerna.
Yes, ma'am. This first picture says, would you just pop up on the couch for me?
Exactly. Pop up on the couch for me, would you? Good. Then let us listen to Nishat. So this
Yes,
is
ma'am.
picture. So the third picture, the first row, this one.
Ma'am, move towards the edge of the. Can you please move towards the edge of the couch?
No, we are speaking about this one, this picture. 1, 2, 3 in the upper row. So picture
Lean
number.
forward. Can you please lean forward?
So can you please lean forward
Lean
a
forward.
little for me? Yes,
Yes.
Little bit, little bit.
a
A
little
little forward.
bit for me. So that was
Yes,
number
ma'am.
5. And let us listen to whom? Who was speaking?
Yes,
Nishat.
Nishat, ma'am.
Nishat.
Yes, ma'am.
Now, Prakriti, please picture. So with a woman lying on the couch. So what should
Ma'am,
she?
ma'am, move toward edge of the couch.
The edge of the couch.
Yes, ma'am.
And the polite phrase. Who remembers the polite formula which was used in this conversation?
Can you please move
If
towards?
you
Can
could
you
just,
please move
if you
toward
could,
the edge of the
if you
couch?
could just move to
If you could.
towards the edge
Yes.
of the couch.
Could you please move
If,
towards the
if you could
If you
just,
could,
just move towards the edge of the couch.
towards the edge of the
Mhm.
couch.
Toward
And the
the edge of
last,
the couch.
yes, and the last one is for Samhita. So this
Yes.
person, the second picture.
Could you please turn over your tummy?
Who remembers the exact
It
phrase?
was,
Can I?
No,
now I
only
want
one.
Now I want
Yes,
you to turn over
turn
onto
over.
your tummy.
Yes,
Exactly.
ma'am.
On to the tummy.
Now I want you to just turn
Turn
over on your tummy.
Onto,
So that was
yes.
the phrase.
Yes.
So you can see that to be polite, we can use a lot of
Listening to.
different phrases. And here's the information about the structure of this kind of phrases. So when we make a request, polite request, we need to speak politely to patients to make them feel comfortable and to calm down because they are in a very hard, serious situation. And so giving instructions to a patient by using a simple imperative can sound very harsh, rude if a patient is ill. That is why we need to soften imperatives. How to soften imperatives? We should add such phrases as, for me, please, like in the example, undress for me, please. Or we can use can or could to make the instruction gentler by changing it into a request. So could is slightly gentler than can. Can you just plus infinitive plus the word please? And there are examples. Can you just bend your head toward forward for me, please? Or could you just bend your head forward for me, please? So for me, can, could, please. So these are the phrases we should use in polite requests. And there are more phrases given here. You can also use if you can, or if you could, or if you can, or could you just plus infinitive plus please. And another combination like infinitive plus if you can, if you could. So the examples. If you can just bend your head forward for me, or could you just bend your head forward for me? Or another example, just bend your head forward for me if you can, or bend your head forward for me if you could. So do remember these phrases. And so also one of the polite formulas is you can also use I'd like you to just bend your head forward for me, please. Well, and also there were some phrases used by the doctors like now, okay, that's it, fine, just, that's fine, good. Just short phrases you can add to your requests to show that you are satisfied with what the patient has done. And let us have a look at these instructions. And let us decide which of these instructions are inappropriate to use with the patient. Are they appropriate? Are they good or bad in the conversation with the patient? And now we stopped with Samhita. Yes, now let's listen to Rafael. Will you read the first phrase?
Yes, ma'am. Could you just lie on your left side for me? It's polite, ma'am.
It's polite.
appropriate.
Okay. Aimeen, please.
Yes, ma'am. It says if you could just pop off your clothes and then I think it should be, it's inappropriate, I think.
Why?
It would be if you could please undress for me and
You think that it's necessary to add please, right?
no, ma'am,
Or
it's not necessary to add please here.
Here pop-off seems inappropriate, ma'am.
you mean this is the
ma'am.
conversational just version phrase. And how to improve this phrase?
If you could just undress yourself.
Undress and then okay, good. So Aronchalam,
Yes, ma'am.
C phrase.
On your left side, please. It's like imperative and ordering, ma'am, but we have to request. So could you just lie on your left side, please? Or right side, could you just lie? Or please, the please as it is in the last we can add, could you just? Or could you?
I see. Good. Well, yes. Thank you. Let's listen to Madhumita.
Just bring your legs up to your chest. Yes, like that, and relax. I'm just going to. It's not so polite, ma'am, because it's just like ordering the patient. It has to be. Could you please just bring your legs up to your chest? And yes, we have to add. Could you please?
Could you please relax, right?
Yes, ma'am.
Okay, yes. Well, so the next is for Divya.
Yes, ma'am. Can you just bend your knees towards your chin and curl your neck? It's like polite, ma'am.
Yes, it's rather polite. Well, and now Priya, please. Priya.
I did like you to stand up for me if you can. Ma'am, it's so polite.
It's very polite phrase. And the last one is for.
Or it can be written as could you.
Okay. And the last phrase is for Prerna, please.
Yes, ma'am. It is take off your shirt. It is inappropriate. It can be, can you just take your shirt off for me, please?
Good. So.
Or can you please take off your shirt?
Ma'am, could
Yes.
you like to take off your shirt for me?
Exactly. A lot of phrases are possible here. So we should understand that polite formulas should be used in the conversation with the patient because just to help, it can help in the doctor's just work to make the patient feel comfortable and relaxed and speak about what worries him or her. And now we're going to complete the sentences with these colored words. And you should also add some other words. So this is the words are make, tilt, pop, keep, stand up, cough, and turn. So I think the word tilt means we should focus on the meaning of tilt. Who can give synonyms to tilt?
Turn, ma'am. Turn.
Turn, bend. Exactly. Okay, so let us have a look at the sentences. And so the pictures here on this slide is it illustrates the word screen, which is given in the first sentence, which you can see in the first sentence. This is the medical screen, hospital screen, that we can see in some words. Okay, now we stopped with the whom. Who was the last person to speak?
Ma'am, Prerna.
Prerna.
Mm.
So Nishat, please.
Yes, ma'am. First one, ma'am. Can dash the screen and address for me, please? Can you please pop the screen and address for me, or like tilt the screen, tilt or turn the screen and address for me?
So this is we should use here the phrase which you don't like, and so is it in front of the screen or under the screen, above the screen? What kind of preposition should we use here?
Can you please turn the screen and address for me, please?
If we use pop, so the screen is used to just make something invisible. Yes, this is for other people. And if we ask a person to undress, so what preposition should be used? Who can help us? No variants. Okay, so what about the second phrase? So Prakriti, please. Prakriti.
Ma'am, I need to examine your lower back. So if you turn.
Turn. If you. This is the polite request. If you
like to turn.
If you would like to turn.
Yes, ma'am. If you would like to turn
to your left,
if you
for
can.
example. Yes, or if the doctor wants to examine the back or the patient's back, what should
so
the
if you cough,
if you're comfortable to turn.
I need to examine your lower back, so if you can cough.
No, turn is okay, but turn how? How should the person turn?
Tilt.
Turn around.
On the back, on his back, or where?
Turn over on tummy.
Ma'am, on his ages. Ma'am, on his age.
On
Turn
the
over to
stomach, yes, on his stomach. Okay.
Stomach, yeah.
Well, the next one is for whom? Samhita?
Yes, ma'am. Just dash for me and again, that's fine. Just tilt for me again and again, that's fine. We can use word tilt here.
Okay, good. So then let's listen to Rafael.
Could dash head to the left? Yes, that's fine. Could you please turn your head to the left? Yes, that's fine. That's it.
Turn your head to the left. Or instead of turn, what else is possible to use in the?
Could you please tilt your head to the left? Yes, that's it.
Okay. So the next one is for Emil, please.
Can you dash tight fist for me? Fine. I think, can you keep
Can you
keep
please
tight?
make?
Can you please
make
it tight or make?
Can you make a tight fist for me?
Can you please make tight fist? Make tight fist.
Make tight fist.
So when can we use this phrase? In what kind of procedure?
Ma'am, it's while taking out blood.
Can you leave?
Yes,
Okay.
Yes, ma'am.
So the next is for
Times
Chalam.
examination.
Chalam, please, number 7.
I still for me if you can, okay. I like you to stand up still for me if you can, if you can. I have like you to stand up, ma'am, and the verb is I have like you to
I
stand
see.
up still for me if you can, okay.
Mhm.
Follow it.
Okay, let us check whether we have the same.
Listening 3. 1. Can you just pop behind the screen and Andreas for me, please? 2.
I need to examine your lower back, so if you could turn onto your tummy for me, please. Thank you.
3.
Just cough for me. And again? That's fine.
4.
I'd like you to stand up for me. Do you need any help getting up?
5.
Could you just tilt your head to the left? Yes, that's it.
6.
Can you make a tight fist for me? Fine.
7.
I'd like you to keep nice and still for me if you can. Okay.
Well, so let's take a break and meet in 10 minutes.
Okay, ma'am.